ADHD and perimenopause. Yes, there is potentially a link. Spoiler alert. And I'm going to tell you all about it because this, by the way, is super important. Guys, I'm Dr. Jen Caudle, practicing family physician. It is good to see you. Okay, first of all, ladies, if you are in perimenopause, I want you to write that in the comments. I would like to know, by the way, I'm there too. Also, I want to know if you have ADHD. Have your symptoms gotten worse in perimenopause? Also, I want to know if you have not been diagnosed with ADHD in perimenopause, have you started to think that maybe you do have it? And if you do, you're not losing your mind. Let me tell you, first of all, for those of you who want to make sure you know what we're talking about, menopause is when you don't have a period for 12 months, okay? That's when menopause starts. Perimenopause is a time before that. It can be a number of years before menopause begins, a couple of years to 7 to 10 years even, often starts in the 30s and 40s, and it's when our estrogen levels start to decline, okay? And that's when all the symptoms start to come. So common symptoms in perimenopause, and by the way, not everyone gets symptoms, not everybody has them, but that's when often our periods start to change. They might get lighter and sort of less frequent, or they might get heavier and longer. Okay. You might have hot flashes, okay? You might have sleep disturbances. You may feel like you have anxiety, depression. You may get migraines. You may have a number of symptoms. Also, you may have what we call sort of brain fog, cognitive changes, things like that. But let's now bring in ADHD and talk about where that fits in, because I think this is really, really super interesting. And I want you to share this video with your friends and family because I think this is something we're going to learn more about. What we have seen in some studies is that perimenopause can, for some people, unmask ADHD symptoms in those who were never diagnosed with ADHD before, sort of reveals it, unmasks it, or exacerbate ADHD symptoms. That means make them worse in people who have already been diagnosed with ADHD. Yeah, we're talking, again, perimenopause, ADHD. Perimenopause can unmask it, be like, hello, I'm here, ADHD symptoms, or exacerbate it in people who've already been diagnosed. This is a big deal. Now look, we're still gathering data. There's still a lot we have yet to learn. This is a connection that we have started to put together, and I always say things can change, but preliminarily, it seems like this may be a potential connection. I want to know from you, what do you think? How do you feel? Is this something that has affected you? Write in the comments. Again, share this with other people. I always say, by the way, too, before you diagnose yourself with, say, ADHD or perimenopause or anything, make sure you see your doctor. And I know a lot of people feel like their doctor doesn't listen, and that breaks my heart, by the way. I want you to find a doctor that listens because you deserve that. But the reason why I say this is because sometimes when we self-diagnose, we may be ignoring the possibility of other things that could be existing. So I say this to say, as a family doctor, I've often seen people with mood changes or period changes, like their menstrual period changes or foggy changes or fogginess or whatever, and it turns out they have a thyroid problem, or they're anemic, or their B12 is off, or their vitamin D, and it may not have been the thing they actually thought. So this is why I say, just make sure you're working with your doctor to get a proper diagnosis so that other things are not being missed. Guys, let me know what you think about this video. Share your thoughts in the comments. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my YouTube channel. Follow me on Facebook, Instagram, TikTok, LinkedIn, WhatsApp, everything. And sign up for my free health newsletter at drjencaudle.com.